Hi everyone, my name is Maz. I'm a second year medical student and I guess welcome to my YouTube channel. This is much harder than it looks, but anyway, so my first video is going to be based on my GP placement, which I went for 3 days. I was traveling back and forth to it. I didn't get to stay anywhere. A little rundown on how I went and how I found the experience and like who I got to work with. So at my university, we have these things called immersion weeks, and I guess the point of them, they're meant to be immersive, right? So we have 4 of them and they're spread out throughout the year. So our year basically starts like October and it ends June. Yeah. I had my GP teaching week at the beginning of like term 1, and then I had just now GP teaching, which I'll be talking about in more detail. Then I have IPE, which is interprofessional learning. I don't know what the E stands for. To finish off, I will have community placement. So I don't know where I'm going yet for community placement, but I'm pretty excited because I like the community and that's kind of where I want to work in the future. So I'm going to give you like a little rundown on how GP placement works. So you usually get 3 days. I had Wednesday, Thursday, and Friday this time, so I was pretty lucky. I had like a 4-day weekend and I was living life. But anyway, so I had to travel to my placement. There's no accommodation in second year and they're normally pretty close by, so you should be able to get like a train, bus, or if you drive, you drive. So normally you have a partner for your placement, but my partner was ill, so I just solo did my placement, which I didn't mind because I don't have a problem talking to people and everybody there was so nice and welcoming, so I just kind of felt like, oh, this is okay, it's gonna be okay. Day 1 was quite busy because I kind of needed to like trial everything out and make sure that I was gonna get to my placement on time without there being any delays on the trains or like buses. I made it to my station and I got off and I was like, I'm gonna get lost, but I didn't. I found my surgery pretty quickly and then I went in. I was early. Like, I always definitely think that if you're gonna be somewhere for a few days, like definitely turn up early to introduce yourself and like I guess make a good impression, and just punctuality is pretty much something you're gonna need for the rest of your life. So yeah.
Wait, which one's lighter out of those two? Okay, get a 4.
First session, I was with a practice nurse and she was really nice. She kind of like just talked me through things we specialised in or can do, and then we saw a couple of patients. So before any patient comes into the room, somebody will tell them that, oh, I have a medical student, are you happy for them to be in the room? And if they are, that's great, thank you. I get to learn a lot. If not, equally, that's your right. And we got them to sign a couple of consent forms so that they could be like put onto the patient notes saying that, you know, a medical student was present. Everybody said that I could stay in, so I got to see things that I would have never seen, I guess, for like at least a couple more years, and stuff that I know some of my peers were told like they need to leave the room, which is absolutely fine. So I was really happy about that, and I'm always really grateful to anyone that's like willing to help with our teaching. It was kind of split up in like the morning, a break, and the afternoon, and I think that's pretty standard for GP as they close for lunch break. Session with the care coordinators, a lot of great stuff for a lot of different patients, so that was lovely to meet that team. And a session with the salary GP, so she kindly invited me in and told me that I could stay in for like the whole session. Then again, we had so many patients.
The next stop is in.
On to day 2. I was pretty knackered, I'm not gonna lie, from day 1. I guess it's like the adjustment of waking up, traveling so much. Like I think it takes me about an hour and a half to travel on a train and then buses home, etc, etc. I don't drive, guys, get your driver's license. Day 2 was pretty fun. Like it was good. It was like heavy and hands-on and I enjoyed it a lot. So I started off my day with a paramedic prescriber. a lot of people don't know that there are a lot of different healthcare professionals that can prescribe. You just do more advanced courses to like learn quite a lot of like what a paramedic could do, and kind of like how their role fits in within the community. CAs can do a lot of things. Like I was thinking more of like a hospital setting, and I thought it was quite limited, but I was wrong. So that's good. Learning new things all the time. Then I had like a little chat with the admin team and basically like kind of what they do behind the scenes. And it's a lot, I'll tell you, it's a lot. I really do give it to them, because honestly, if they weren't doing their job, then I don't know how the whole place would not fall apart, you know? Don't know what social prescribing is, I would definitely encourage you to like Google it. Day 3 is my final day, and I am pretty happy because I got to leave early. Technically that wasn't my fault, the trains kept cancelling through my day, so it did not start off at all the way it was planned, which is absolutely fine because the things happen, life happens, and you have to adjust, right? So give you a little rundown because it was quite a short day. So I had started the morning with an admin manager. She's lovely, she's the one that introduced me to the whole place and kind of gave me like a walkthrough. In with the clinical pharmacist. So I don't know, I used to work in community pharmacy for 3 years. Interesting to see the difference between a clinical pharmacist and a community pharmacist. Sit in with the advanced nurse practitioner again. It was quite a busy clinic, if I'm being honest. That people come in for this time of the year repeat themselves. Interesting to see that. A lunch break, so sit in with a practice nurse, but things happen and there was just too many people in the room, so I left and I went to go sit in with the HCA. And then after that I just kind of realised that the trains were just cancelling on me like they did in the morning, or they were being delayed, like heavily delayed, and I just did not want to be somewhere for such a long time. It is the last day for me and I have been looking forward to this day for a very long time. So I asked the senior GP, no, partner GP? I don't know. A GP, a doctor, I guess in charge of me and my final bit of the rota. So I asked very politely if I could leave and he said yes. That was my GP experience. I very much loved it. I would highly recommend to be very engaging in your GP practice, even if you don't like it. Like people that I have met at medical school and they're like, I can never be a GP, or why would you be a GP? I think by the end of it, from speaking to like 5th years, a lot of people are going to be GPs, so keep an open mind, I guess. I will see you at my next vlog, if that's ever going to happen.